Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So let's take a look.
Hi everyone, today we are going to explore Dapagliflozin, an essential medicine to control type 2 diabetes and heart failure. Dapagliflozin is mainly used for type 2 diabetes. Its function is to lower blood sugar levels by making your kidneys remove more glucose through urine. It is also beneficial for those who have heart failure, as it improves how the heart works and reduces the risk of needing to be admitted to the hospital. Are you wondering how it works? Dapagliflozin is part of the SGLT2 inhibitor, also known as sodium glucose cotransporter 2 inhibitors. Their job is to prevent the kidneys from reabsorbing glucose, which makes it easier to eliminate it through urine. About the dose, it is usual to start with 5 milligrams once a day. Depending on your response to the medication and how you tolerate it, the doctor could increase it to 10 milligrams daily. It is important to always take it at the same time, with or without food. And remember, do not change the dose on your own. Strictly follow your doctor's instructions. Like any medicine, dapagliflozin can cause side effects. Some patients experience urinary tract infections, extreme thirst, or dizziness. If you experience severe symptoms such as intense pain, fever, or allergic reactions, see a doctor immediately. Also, it is important to know that it is not recommended if you have severe kidney failure or are dehydrated. In summary, dapagliflozin is a great ally to control type 2 diabetes and heart failure. Take it just as your doctor tells you, check your blood sugar levels regularly, and do not hesitate to report any side effects. Thanks for joining me. Take care.
If you've made it this far, let us know in the comments why you're using this medicine.